Hello, welcome to any community. In this particular video, we are going to discuss how to identify a Nidana in a patient. There are several factors of Nidana that may be exposed by an individual at a particular time period. Sometimes maybe one Nidana, sometimes maybe a 10 Nidana, sometimes maybe 100 Nidana. But the one Nidana which is responsible for the disease manifestation may be unique. We have to identify that particular Nidana in that particular individual. In this video, we are going to make a note on this particular aspect. When you try to identify a Nidana in a patient, first of all, you need to know what actually Nidana is. So, Nidana is used in two different contexts. One as the diagnostic measures, second one as the etiological factor. Diagnostic measures in the sense they are Nidana Panchaka, Nidana Purarupa Rupa Upashaya and Samprapti, and causative factor as that is the Karana or the Hetu itself. The definition of Nidana based on the causative factor that is being mentioned in Madhava Nidana, Madhikosha comment 5th chapter. Seti Kartapyata ko Rogotpadaka Hetur Nidanam. The one which is responsible for the different types of the Kartapyata, which is responsible for the manifestation of disease, that is being termed as Nidana. So, the term Kartapyata refers to the Vividha Dosha Vyapara. Dosha Vyapara in the sense there may be a possibility of abnormal functioning of these dosha happening inside the body. The person who is having the less movement of the Vata dosha leading to Vibandha, it is considered to be a type of the Deha Vyapara or Dosha Vyapara. Whereas the excessive movement of this Vata dosha leading to Atisara, then also it is considered to be the another main function. So what you say that the dosha Vyapara. We have to identify what particular Nidana is responsible for this kind of the abnormal functioning of these particular bioenergies or dosha. For that, first of all, you have to identify what particular Lakshanas are present in an individual. For example, if the person is suffering from the excessive loose stools since 2 days, so that means we have to identify what particular Nidana he has been exposed on that particular 2 days as such. So here, an example is being given. A 26-year-old male, he is having the three presenting complaints in a matter of the 30 days duration. We have to identify the first presenting complaint and we have to identify what particular nidana the person may be exposed to on that particular day that has to be analyzed. And after that, he is giving the another presenting complaint at around the 15th day. We have to identify which particular dosha is being afflicted and what might be the possible nidana that is being present in an individual that has to be analyzed. And the 30th day, he is having third presenting complaint. So we have to identify which particular dosha is being afflicted and what might be the possible nidana that may be attributing this particular presenting complaint that has to be analyzed. So when you think about the uh, whole timeline of 26 years, this may be the what do you say that the clinical presentation, it's a timeline. When you think about the whole 1 month as such, the timeline is much more increased. But whereas if you think about the timeline of 26 years, the timeline of these particular three presenting complaints, they are comparatively smaller. Suppose if the same presenting complaints are present in a 62-year-old male, among that he is giving the two main histories related to two previous illnesses. At the age of 15 years, he is presented with jaundice as such, what we can say common. There will be pitta dosha dominance at that particular time period. So, and he is giving the at the age of 40 years, he is giving the another history of diabetes mellitus, where there may be a possibility of kapha dosha dominance or vata dosha dominance. And these two that may have an impact in due course of time. Probably, of course, the effect may be negligible. We have to look into those aspects, previous histories into consideration whenever if you are making a, what do you say, the identifying the Nidana as such. So if the same three presenting complaints are being present in the individual at around 62 years as such, this may be the type of, what do you say, that the presenting complaints, timeline of the presenting complaints. Whenever if you are identifying the person is suffering from any kind of the presenting disease as such, then we have to identify the actual pattern. Pattern in the sense that is nothing but the repeatedly occurring events. Let us say, for example, the person is doing the running at night time, and the duration of running will be around 45 minutes, and he is doing that for continuously for 3 days, that too in the winter. In that particular situation, we can able to identify the pattern of 3 days running, specifically for continuously 3 days, that too at night time, which is considered to be the timing of this. For example, if it is around 8 p.m., there may be a possibility of kapha-dosha prakopa there naturally. 45 minutes duration, there may be a possibility of vata-dosha vitiation. And in winter, as such, then we may expect there may be a possibility of Shita Guna increase at that particular time period. So this is what we can say, identifying the pattern as such. If the Lakshana are specifically seen in one area of the body, for example, knee joint itself, one knee joint, then the probable Nidana that may be attributable to that particular joint itself. For example, the trauma to the knee joint. Suppose if the person is having the presenting complaint related to multiple body parts, then the abhighata, etc., that may not be the possibility. In that particular situation, some kind of the etiological factors, they are responsible for the total derangement inside the body. So that is what we can say, the endogenous factors that may be responsible for the presenting complaint we have to analyze. First and foremost thing, we have to know about what particular bahya srotas that may be afflicted. It is being mentioned in case of the males, there may be one mouth, two nostrils, two eyes, two ears, and one urethra and one anus. Whereas in case of the females, above 9 orifices plus one vagina and two breast tissues. So these are the bahya srotas, they are being present that may be afflicted, that has to be analyzed first. Whenever the person is having the exposure, disease manifestation, so if it is entering through these particular natural orifices, then we are going to expect the affliction of these bahya srotas first. For example, if the person is having the exposure of the pathogen is happening through the mouth, then we are going to expect either tastelessness or either the taste imperception or pain in the mouth or irritation in the mouth, etc. Suppose if the person is having the exposure of the particular pathogen into the through the nose, then the person may have sneezing, then cough, running nose, nasal blockage, pain in the ears, etc. If the exposure of pathogen is happening through the eyes, then there may be a possibility of the, the itching around the eyes, then watering from the eyes, then redness of the eyes, etc. Then if the exposure is happening to the ears, then the person may have itching around the ears, or the person may have the abnormal discharge through the ears that may happen. If the pathogen is entering through urethra, then the person may have burning micturition, or the person may have pain in the suprapubic region, etc. Exposure through the anus is happening, then the person may have itching around the anus or bleeding Bleeding may occur through the anus, etc., or abnormal discharge that may happen, or pus discharge that may happen via anus. If the exposure of the pathogen takes place via vagina, the lady may be presented with the itching around the vulva, or the person may have abnormal discharge through the vagina, etc., that may be observed. Pain in the breast as such may be there if the exposure of the pathogen is happening via breast tissue. That may be associated with the pus discharge through the breast tissues as such that may be observed. So in total, first and foremost thing, we have to analyze which particular bahya srotas that may be afflicted. In this particular example, as the person is running continuously for 45 minutes, then there may be a possibility of exposure of the pathogen that may happen because to the two of the main orifices, one that is through the mouth, second one that is through the nose. And when there is the exposure of pathogens happens through the mouth, as we have discussed earlier, the person may have what you say that the entry of the dust particles, etc., that may happen through the mouth. Thereby, the person may develop sneezing or the hoarseness of voice, cough, etc. So this is actually happening because of the effortful breathing. And second route of entry of the pathogens that may be through the nose, wherein the person may have sneezing, running nose, nasal blockage, the heaviness of the head as such, etc., etc. The next point that we have to analyze, that is which particular abhyantara srotas that may be afflicted. In this particular example, as the person is doing the running continuously for 3 days at winter for 45 minutes, one of the possible srotas that may be afflicted may be pranavaha srotas. If the person is doing the running after a full stomach, then there may be a possibility of annavaha srotas affliction. Or otherwise, if the person is doing this particular running on empty stomach, then there may be a possibility of a pranavaha srotas affliction, wherein exposure of this particular pathogens that may happen via mouth or nose. And if the person is doing the excessive running, then there may be a possibility of asthi vahas affliction, wherein the person may have tearing type of pain in the bones, or tearing type of pain in the joints, or pricking type of pain in the bones, or pricking type of pain in the joints as such. That is being observed in an individual. Plus, there may be a possibility of a majjavaha affliction, because Asthi and Sandhi are considered to be Mula of Majjavaha Srotas as such. Along with that, there may be a possibility of Svedavaha Srotas affliction, because Vyayama is considered to be the causative factor for the affliction of a Svedavaha Srotas also. So, as such, initially what we have to see, what particular Bahya Srotas is being afflicted, then we have to see what are the abhyantara srotas that may be afflicted in an individual. Then, how to know about these Bahya and abhyantara srotas affliction? The first and foremost thing, as we have discussed earlier, we have to know what particular Lakshana related to Bahya srotas are observed in an individual that has to be analyzed. The Lakshana that we have discussed earlier in the context of Bahya srotas as such in this particular video. As far as Abhyantara Srotas Lakshana that has to be analyzed, so there are specific Lakshana are being mentioned in the Ayurveda textbooks. For example, Pranava Srotas affliction, that is Atisrishtam Atibaddham Kupitam Alpalpam Avikshnam Va Sashabda Shulam Uchvasantam Drishtva. As far as Udakava Srotas are concerned, Jikhva Talu Oshta Kantakloma Shosham Pipasam Jati Prabhuddham Drishtva. As far as Annava Srotas is concerned, Ananna Bilashanam Arochaka Vipako Chardim Chadrishtva. Rasabha Srotas Ashraddha Charjichasa Ashraddha Charjichasa Vairasya Marasadnyata. Krillaso Gauravam Tandra Sangamardo Jvarastamaham Panduttum Srotasamrudah Klaibyam Sadah Krishangata Nashogni Rayatha Kalam Valayaha Palitanija. As far as Raktaba Srotas affliction are concerned, Pushtabi Sarpapitaka Raktapittamasrigdaraha Budamitrasya Pakashtipliha Gulmutha Vidradihi Nilika Kamala Vyanda Viplavastilakalaka Dadrushcharmadalam Shutram Pama Kothasramandaram Mamsavah Srotodushti Adimamsarbutam Kilam Galashaluka Shundiki Puti Mamsalajing and Gandamalopa Medavah Srotas as such Nidani Pramehana Pururupani Anicha अस्तिवाह स्रोतस् अध्यस्तिदन्तौ दन्तास्ति भेदशूलं विवरणता केशलोमन कृष्णश्चो दोषाश्चास्ति प्रदोषजा मज्जवाह स्रोतस् ऋक्पर्वणां भ्रमो मूर्छा दर्शनं तमसस्तथा अरुषां स्थूलमूलानां पर्वजानां च दर्शनम् शुक्रवाह स्रोतस् शुक्रस्य दोषः क्लैब्यम् आहर्षणं रोगी वा क्लेबमल्पाय विरूपं वा प्रचायते न चास्य जायते गर्भः पतति प्रस्रवत्यपि शुक्रमिदुष्टं सापत्यं सदारं बाधते नरम् प्रदुष्टानां तु कल्वेषामिदं विशेष विज्ञानं भवति तद्यथा अतिसृष्टमतिबद्धं प्रकुपितमल्पाल्पम् अपेक्षणं वा बहलं सशूलं मुद्रयन्तं दृष्ट्वा. As far as Purusha Srotodushti are concerned, Krichnalpalpam Sashabdashulam Atidravam Atigratitam Atibahuja Upabhantam Drishtva. As far as Swedava Srotas are concerned, Asvedanam Atsvedana Parusham Tishrakshatam Angasya Paridam Lomaharsham Chadrishtva. Swedavahanis Sokam Sapudushtani Vidya. By looking into these different aspects, we can able to identify the Abhyantara Srotas affliction. As far as the next point that we need to know regarding the Doshadhatu Mala Vriddhikshaya Lakshana are being present in the patient or not. When you think about the Vata Dosha Vriddhi as such, Pradastu Kurutine Lakar Shikarshnushna Kamitva Kampara Shakridkaran Malanidrindiya Brahmsha Pralapa Brahmadinata Pita Vinmutra Netratva Kshitrita Halpa Nidrata Puttam Shrishmagni Sadana Prasekalisya Gauravam Shvaitya Shaitya Shatangatvam Shwasaka Sati Nidrata. As far as Dhatu Vriddhi are concerned, Raso Pishlesh Muvad Raktam Sarpaplivad Radhin Kushtavatasra Pittasra Guluma Pakushatamala Vengagni Nasha Samuhar Tatva Netra Mutrata Mamsam Gandar with the Granthi Ganduru Daravudita Kanta Dipshudi Mamsam Chatadvan Medastatashramam Alpe Pichesh Deshvas Swixtano Daralambanam Astyadyas Tidudantam Chamajja Netranga Gauravam Parvasas Tula Mulani Kuryat Krishrani Arumshucha Atisri Kamatam Ruddham Shukram Shukrashmari Mapi. As far as Malavriddhi Lakshana are concerned, Tukshavathmanam Atopam Gauravam Vedanam Shakrit Mutram Tavastini Stodam Krite Apyakrita Samyatam Svedoti Sveda Dordanti Kandurevam Chalakshaye. As far as Doshakshaya Lakshana are concerned, Lingam Shini Nilengasya Sadulpam Bhashitetam Sanya Mohasata Shleshma Ruddikta Maya Sambhava Pitte Mando Analashitam Prabhahani Kafi Pramaha Shleshma Shayanam Shunyatvam Rudrava Shratasandita Dhatukshaya Lakshana are concerned, Rase Ruksham Shamaha Shoshu Grani Shabda Sashnuta Rakte Amla Shishira Priti Sirajitila Rukshata Mamse Akshaglani Gandas Vishwishkuta Sindhivedana Medasi Swapanam Katya Prikno Vriddhi Krishangata Astnyasito Daha Sadanam Dantakeshana Kadishu Astana Majjani Saushira Brahmasti Mira Darshanam Sukre Charat Pusitya Shukram Shunitameva Todotyatam Shanayurametram Dhumayati Vacha Malakshaya Lakshana are concerned. Purishe Vayurantrani Sashabda Vesta Inna Kuksho Brahmati Atyurtham Parshu Pida in Brasham Mutrelpam Mutrayet Krichas Governam Sastra Meva Swede Romachiti Sabdharomataspatanam Twacha. These are the things that we have to analyze whenever if you are looking into the knowing the Bahya Srotas and Abhyantara Srotas affliction in an individual. In this particular occasion, as we have discussed, there may be a possibility of a Pranavah Srotadushti, Astivah Srotadushti, Majjavah Srotadushti, and Svedavah Srotadushti. If the person is doing the running after full stomach, there may be a possibility of Annavah Srotas affliction also. As far as the next aspect, then we have to know about the framing out the Samprakti proper. So here, whenever the entry of the pathogen is happening into the body, suppose if the person is doing the running as such, there may be a possibility of entry of pathogen that may take place through the mouth. Whenever this may happen, there may be a possibility of entry of the pathogen that may take place either through the respiratory passages or through the alimentary canal. Whenever there is the entry of the pathogens that may take place through the alimentary canal, then there may be a possibility of the pathogen entry that may take place from the alimentary canal to intravascular compartment of the chest in this particular example. When these particular pathogens are entering into the intravascular compartment of the chest. The next area where that may move into the interstitial compartment of the chest. And at last stage, there may be a possibility of entry of the pathogens that may take place into the intracellular compartment. Then let us take the another example. Here, if as the person is doing the running, one particular joint that may be the having the increased blood circulation may be the knee joint. So that means from the alimentary canal, there may be a possibility of entry of the pathogens that may take place to the intravascular compartment of the knee. Later, that may move into the interstitial compartment of the knee, and at last, that may enter into the intracellular compartment of the knee. So that means framing out the samprapti is another major area where the identification of Nidana may be helpful in predicting the possible pathogenesis. The take-home messages from today's discussion are: whenever the person you are interacting with the patient, you have to identify the Lakshana present in an individual first. After that, which particular Bhashya is being afflicted, that has to be known. And then we have to know about which particular Abhyantara Srotas is being afflicted. And after that, we have to try to make out the Samprapti analysis properly. These are the keys which may help you to identify the exact Nidana that may be observed in an individual. Dear community, that's all for today. What are the major key takeaways from this discussion? Mention in the comment box below. And what is the one video that you like to hear in this particular channel in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.